Welcome to the IWK Health Center. We are very happy to assist you with the birth of your baby. We'd like your stay with us to be as welcoming and comfortable as possible. Please take a few minutes to watch this video as it will explain many of the experiences you will have during your stay with us.
When you think you might be in labor, come to the Women's Site at the IWK Health Center. You'll find us at the corner of University Avenue and Roby Street. The Women's Site is next to the fire station. If your support person is driving, you can pull into the entrance of the Women's Site for a short time. This way, your support person can assist you to the admitting department and retrieve any items you might need from the vehicle. While you are in admitting, your support person must find parking. There is metered parking on the street and a parking garage located on University Avenue. If you use the parking garage, remember to keep your parking stub with you. When you are ready to leave, simply take your parking stub to the pay station in the gallery. Keep your validated parking stub and use it to exit the garage. Once you enter the health center, please go directly to the admitting department. Walk past the security desk and you'll find it on the right. There will always be someone there to help you. Admitting is open 24 hours a day, 7 days a week. Remember to bring your IWK White Hospital card or your provincial health card with you for registration. At any time during your pregnancy, you can visit admitting and pre-register. This will make your admission during labor quick and easy. Once you've been admitted, you and your support person will be given security access cards. These cards allow you easy access to the birth unit. You'll then be assisted to a private elevator that will take you directly to the 3rd floor where the early labor assessment and birth unit are located. A nurse will meet you in the early labor assessment unit and she'll take you to a private room for a physical exam and to listen to your baby's heartbeat. If you need an interpreter, the nurse will contact the interpreter services and arrange to have one come in. The nurse, in discussion with your doctor or the doctor covering your care, will assess whether you're in early labor or true labor. 3 things can happen next. If you are in early labor and live close to the health center, you may be sent home. If that happens, your nurse will give you guidelines on when you should return. If you are in early labor but have traveled a great distance to get to the health center, your nurse can help you with other plans. If you are in active labor, you will be admitted to one of our fully equipped private birthing rooms. Your birthing room is where you will spend your active labor and deliver your baby. All the equipment that may be used during your labor and your baby's birth is in this room. Your private room will also have a telephone, a private washroom, and bathtub. Equipment such as a birthing ball, squatting bar, mirror, and CD player are available if you would like to use them during your labor. Once you're in active labor, you will receive one-to-one supportive care throughout your labor and birth. All of our birth unit nurses are educated in supportive care in labor. If you have a birth plan, your nurse will go over it with you and your support person. While you are in active labor, water, juice, and popsicles are available. Your support person is responsible for his or her own drinks and food. There is a cafeteria, coffee shop, and vending machines in the health center for their use. Food outlets in the health center are not open 24 hours a day, so it's a good idea to bring prepared snacks and drinks from home for your support person. The IWK Health Center encourages mothers to make decisions on methods for coping with labor. You can walk, change positions, use the birthing ball, or use the bathtub. Some women require other methods of pain relief, and these can be discussed with your nurse. If you choose to have the help of a doula or midwife during your labor, they're welcome to support you in the birth unit. Your nurse will check you and your baby regularly during labor. The IWK Health Center is a teaching hospital for students in the health professions. You may be asked if a student can follow you throughout your time in the birth unit. Some families wish to have their other children with them during the birth. Children under 12 years of age require an adult to supervise them. After your baby is born, you'll spend some more time in the birth unit. During this time, you'll be supported as you feed and get to know your baby. It's the philosophy of the IWK to promote and support breastfeeding and to respect the decision each mother makes about how to feed her baby. Before you leave the birth unit, your baby will be weighed, have an ankle identification band put on, and receive vitamin K and eye ointment. When you and your baby are ready, you'll be moved to the family newborn unit. Having a baby is an exciting but exhausting time. You'll be learning so much about your new baby while at the health center, and you'll need to get rest whenever possible. It's a good idea to ask your friends to wait and visit you after you get home. There is a daily quiet time on the family newborn unit from 2 to 4 p.m. There is no general visiting during this time. Quiet time provides families with much-needed time to rest and receive extra help from staff. Your partner, support person, baby siblings, and grandparents are welcome to visit anytime. Your room on the family newborn unit will have a washroom with a bathtub. Your baby will stay with you in your room. Every new mother and her baby have a nurse assigned to their care. Each nurse cares for 3 or 4 other families as well. You may have several different nurses care for you during your stay. Your time in the newborn family unit will give you a chance to learn many things about caring for yourself and your new baby. You will also get help with feeding your baby. As you get to know your new baby, you'll learn his or her language and cues. Every family is given a booklet called Keys to Caregiving. It's a helpful guide for parents showing you how to recognize your baby's cues. The nurses are always available to help answer your questions about your new baby during your time in the family newborn unit. The usual stay for someone who has had a vaginal delivery is 2 days, 3 days after a cesarean section. In most cases, your support person can stay with you in your room. The family newborn unit does have a number of cots for this purpose. However, there is not a cot for every room. If you would like a cot, please request one when you arrive on the unit. The person staying with you is there to help you with your baby and be a part of the learning experience. Your support person is responsible for his or her personal items and meals. Don't forget to pack your night clothes. Pajamas are required. The day before you're discharged, it's a good idea for you and/or your support person to attend the daily discharge information session. Ask your nurse about the time and location. While you're on the family newborn unit, there will be papers to fill out about your baby. Your nurse can help you fill out these papers. You can also ask your nurse any questions you have before you go home. Your baby will have a hearing test and routine blood tests. There is a photographer available if you wish to purchase pictures of your baby. Before discharge, your baby will receive a free bag of baby books from the Read to Me program, because learning begins early. Books are a great way to get to know your baby. It will also help your new baby learn language. It is the law in Nova Scotia and the rest of Canada that all babies being transported in a car, van, or truck must be properly secured in a federally approved car seat. You'll want to buy your car seat before the baby is born, so you can practice getting it installed and secured in your vehicle. Call Child Safety Link at 470-7036 or drop by their office in the health center if you have any questions about car seats. The Neonatal Intensive Care Unit, or the NICU, cares for babies with special health needs. The IWK NICU cares for babies from the Maritimes and Bermuda. Just because your baby is admitted to the IWK NICU does not mean that your baby must stay in Halifax for an extended period. Babies from outside the Halifax area may be transferred to a hospital closer to home at a later date. The Neonatal Intensive Care Unit is for babies with very urgent medical needs and contains equipment especially designed to assist those babies. The NICU team is made up of a number of specialized healthcare providers. A stay in the NICU does not end a mother's opportunity to breastfeed her baby. The staff is committed to supporting breastfeeding in many ways and will assist mothers with breastfeeding and pumping as needed. Before a baby goes home from the NICU, there will be information and learning opportunities to help families feel more comfortable caring for their baby. If your baby has spent time in the NICU, your family may be contacted for perinatal follow-up visits. Prenatal special care varies with the health needs of the mother and can include day treatment, hospital stays, or home care. Here, the mother and her family will work very closely with the healthcare team to best meet the mother's needs. If a hospital stay is required, a support person can usually stay too. However, there are only a limited number of cots in the unit. Please request a cot for the support person when admitted. The support person is there to support you during your stay in the hospital and must look after his or her own personal items and meals. Please remember, pajamas are required. Families are encouraged to have their children visit. Children under 12 require an adult, other than the patient, to supervise them. A family lounge is available for use as a children's play area or a place where families can play board games or watch TV. There are also other places in the health center where families can spend time together. Prenatal Special Care Unit provides access to other resources that may help make your stay more comfortable, including a washer and dryer, a patient kitchen, daily newspapers, free movies, and nutritious snacks. Thank you for taking the time to watch this video. We hope you have found it helpful in answering some of your questions. Please contact the IWK Health Center for more information